Meanwhile, Florida health officials are downplaying the importance of being tested for COVID-19 if you're not showing any symptoms of the virus. The Florida Health Department issued new testing guidelines today. It suggests people who are at an increased risk for severe illness, like older adults, those with medical conditions, or those who are pregnant, should be tested if they're showing symptoms. Now, if you have symptoms and are not at high risk, the guidance says to consider being tested after symptoms start. And if you've been exposed to COVID-19 but do not have symptoms, health officials say testing is unlikely to have any clinical benefit. The governor and the state surgeon general have been hinting at these guidelines all week.
The clinical benefit of that for somebody that's healthy and is just going to get tested to figure out whether they're sick or not, that is very low value testing.
News for Jax reporter Jim Pickett live at a testing site on the south side after speaking with doctors, Jim, about these recommendations.
You know, I'm out here. This is Cuba Hunter Park. This is a health department site, and we expected to see lines out here, but something happened here today. They had to close this testing site early today, and they had to do that earlier this week. And what the health department is saying is unforeseen circumstances. So there's some concern about that the testing was not available here. But I've been at a number of other sites today as well. And there were some lines, but not as heavy as they were earlier in the week. People are getting tested all for the same reason. They said they've either been exposed, they felt sick, and they just want to know.
Michelle McCarn is a housekeeper and doesn't want to pass on the virus if she has it. That's why she's being tested today.
Just because I believe that I'm not feeling well, and I just want to make sure.
Have you been exposed, or you just...
I don't know if I've been exposed.
According to the new recommendations from the state, she should consider being tested, but the guidelines don't say she should get tested right away. The idea is confusing to some. We talked to Dr. Mohammed Reza, an infectious disease specialist, who says testing is vital to getting a handle on this pandemic. And he believes telling people not to get tested when they've been exposed is a mistake.
It's like trying to fly without a radar. It's like trying to get through the dark without a flashlight. You know, those testing provides us that guidance.
Would I be safe to say you're surprised by this new guidance?
I am, and I understand where they're coming from, but at the same time, with COVID and with flu, you can have no symptoms prior to you become symptomatic. With COVID, up to 2 days. With the flu, at least 1 day before. So you're spreading that virus to everyone around you unknowingly and feeling just fine.
So I came here to the Duval County Health Department to try to find out what they think of this new guideline. Well, normally they're very talkative, but today, no comment.
But some of those in line today being tested, like Rosa Sanders, say she understands why some may not need to be tested. She's been vaccinated, but she's feeling sick. That's why she's here.
I think if they don't have symptoms, there's no need to be tested. But of course, if you're experiencing symptoms and if you've been vaccinated, I think you should be tested.
And the governor did say there's no rule saying you can't be tested. But he says this would help with long lines for those who really need to find out if they're sick with COVID.
And I'll tell you, it was a surprise here at Cuba Hunter Park that they closed today without really notifying people, just a small sign up there. Now, I'm told they're going to be open tomorrow at 9 a.m. and they're supposed to be open till 6 p.m., but who knows? So we're going to keep checking on that and try to find out the latest here. For now, we're live on the south side. Jim Pickett, Channel 4, the local station.